Hello friends, today we'll discuss about the previous year questions. So first it is the hypersensitivity reaction which is induced by sensitized T cells. Okay, so here always remember the T cells, it is mainly because of the delayed hypersensitivity. So here the option will be like delayed hypersensitivity because the sensitization usually occurs following the antigen exposure. Okay, so that will be about 1 to 2 weeks only. So what happens is the antigen processing cells will be taking these antigens and they will be presenting to the T helper cells. So the T helper cells, which in turn differentiates into T helper 1 cells, and then that will be causing a delayed hypersensitivity. Okay, so always remember, if you are coming across the word T cells, it is mainly because of the delayed hypersensitivity. That is in type 4. Okay, so coming for second question, the anti-helminthic agent which is preferred for the treatment of neurocystic sarcosis is albendazole, niclosamide, pyrantel pomade and the ivermectin. Yeah, it is an always remember, for neurocystic sarcosis it is an albendazole. So here the albendazole, praziquantel and surgery also can be done if you are suspecting any ocular or the spinal cord ventricular lesions. So coming for third option, so acute phase reactants are all of the following except. So first you want to know what are the acute phase reactant. Okay, these are the proteins which usually get elevated during the inflammations. So and here there is a two types. One it is a positive, another it is a negative. Okay, so here the option correct answer is D dimer. So just you remember what are the negative. Okay, so negative it is like ATA, one for albumin, transferrin and antithrombin. So rest are all will be in positive. Okay, so here what happens is, so the positive are they are usually, as it is a positive, it is usually get increased during the inflammation, whereas negative it is decreased during the inflammation. So as I told already, you just remember the negative phase so that you can easily exclude about the positive. So coming for the positive, steroid amyloid A and C-reactive protein and complement factors like C1 to C9, factor B, factor D and propyridine and fibrinogen 1 Willebrand factor, alpha-1 antitrypsin, alpha-1 acid glycoprotein and mannose binding protein, haptoglobin and metal binding proteins. Okay, so these are the examples for the positive acute phase reactant. So hydatid disease is caused by Tinea saginata, Solium, Echinococcus granulosus and Fasciola hepatica. So as you know here, the correct option is Echinococcus granulosus. Okay, so and there is a specific test you want to remember in Echinococcus granulosus is, one it is a Cassoni test, another important sign it is a water lily sign. Okay, so these are some of the tabular column for Echinococcus granulosus. Just remember that it is usually present in the small intestine and usually get transmitted by eating the contaminated waters or the food. Okay, by drinking water or contaminated food. So next, definitely host it is a dog and intermediate host is sheep, cattle and the goat. And this is hydatid disease is caused by Echinococcus granulosus and the test or Cassoni test and the serology. So coming for fifth option, so rheumatic fever, it is a non-suppurative sequelae following the infection of. So one, it is a Streptococcus pyogenes, Streptococcus agarictius, Streptococcus mutans and Staphylococcus aureus. Yeah, nothing, it is a Staphylococcus pyogenes, the answer here. So you want to remember these two, that is it causes a suppurative and non-suppurative lesion. So non-suppurative or respiratory infection, skin infection, erysipelas and impetigo, whereas non-suppurative lesions are the post-streptococcal glomerulonephritis and the rheumatic fever. Okay, so these are the again in this I think this question has been repeated twice. Okay, so what is the type of choice for the neurocystic sarcosis? The way they have asked is different, but the answer remains the same. Okay, so thank you friends.